Ma'am, I want 400 cc of breast implant, or I want a cup D breast implant. But no, this is just not what defines what implant you want. Hello, I'm Dr. Sheetal Londhe. I'm board certified plastic surgeon practicing at Zero Size, Viman Nagar, Pune. Some random, internet search, some questions to the chat GPT, and they have all that things in there. And then they'll just come and say, ma'am, I want 400 cc of breast implant, or I want a cup D breast implant. But no, this is just not what defines what implant you want. Agreed. It is your choice, your body, and your decisions to choose for the size. But there are many parameters which are to be taken care of before we decide on what size and what type of breast implant goes inside. Okay, so now let's break them one by one and understand. First, what is the basic need of that patient? So we will see first what is the chest circumference, one thing. Then we will see what is the base where the implant is going to go and sit, right? So if a female who is about having a chest width of 14 centimeters, I cannot put a breast implant which has got a base of 10 and 10 centimeters. That is going to be 20 centimeters. Just an example. No one has a chest width of 14 centimeters. It's usually one side that's 14 centimeters. So these are all the calculations that we have to take. Next, what is the breast tissue available with the girl? Okay, so if she's already a cup size of B and she just wants to go, one cup size more, then we just need to add 150 cc of breast implant or something like that. But if the same female is a cup size A and she wants to go to cup size C, then we need to add more cc's of breast implant. So these are the things that we have to take. So what happens when you come for a consultation with a plastic surgeon for your breast implants? One is your height is measured, your weight is measured. Second, your at present breast volume is been calculated. Then what is measured is your chest circumference. Then your distance from your supraclavicular notch to the umbilicus, your inframammary folds, where are they sitting? And where does the nipple lie from a distance from your suprasternal notch? So that distance is basically measured, which in an ideal Indian female should be between 19 to 20 centimeters. So after all these measurements are done, we will see what is the base that we get on each side to place the implant. Now, why is this important? Because, like for example, if I tell you this is an implant which is 350 cc. This is also an implant which is 350 cc, right? Now I have two other implants. This is 250 cc and this implant is also 250 cc, right? But look at the difference that is there. So this 250 cc, when I measure the base, I have a base of 110.5, okay? And the same one when I measure here, see, it is also 250, but it goes less, okay? It comes to 90. So that is a difference. Same volume, but diameters are different. So this will sit for a good broad female who has a good volume of breast and just needs few cc's to be added. This will sit for a lean female with a small chest and requires the same volume of addition. Whereas if you see these two, they'll go for a female who's tall but has a good volume and needs a good volume. So this will be going there. So you got to know, that is, we've seen the chest circumference, we have the chest base where the implant goes and sits. Now again comes the projection. Now in these two also, if you see, they have the same side, but when I turn it around, you will see this has got more projection, this has got a less projection. Now what is projection? That is the distance from your diameter to the tip. So this distance, that is what is measured. So it can come from 4.3 centimeters, 4.9 centimeters, 5.8 centimeters. It depends upon that. And that is what is called as low profile, mid profile, or high profile breast implant. So these are the calculations that we will take when we are deciding on breast implant in cc's. That is the volume. Now, again, one more thing is, where does the breast implant sit? So that again is depending upon the patient's tissue. So we have a pinch fold thickness where we pinch the breast and see if it is more than 2 centimeter or less than 2 centimeter. Less than 2 centimeter, it goes below the muscle. If it is good, nice volume, more than 2+ centimeters, then yes, a subpectoral breast implant also sits well. So these are the technical points which we as a doctor calculate when putting a breast implant. Yes, you as a patient, you also have many doubts. So these are the technical things that we as a doctor see. You as a patient have many questions, many doubts. What size of implant? Which plane will it go? Which brand will be used for me? Which type will be used for me? Where will be the incision lying down? And all these your questions, feel free to ask us. We are here to answer it. If you need anything, just give a buzz on this number and we'll get back to you.